Yes.
So maybe if
We sit and watch the world rush by like birds trapped in a cage. We
second. Hi to all of you. I'm very happy that I can be a person that is going to represent all of you that are joining here. And I hope that we're not going to have any problems like we had in the very beginning with some people joining and having some problematic videos. And today we are all here in order to speak about the World Mental Health Day and to raise the awareness in this day. And I'm very happy that we have like 3 participants that are going to have this dialogue. And the first one that we have to start with is going to be Kamila. She's an MD and she's a psychiatrist and staff in the psychiatry department of Dr. Mohamad Soewandhie General Hospital, Surabaya, Indonesia. After that, we are going to have another participant. This is Sara Makka. She is a research consultant and master in neuropsychology. She is also the Universal Scientific Research representative of Lebanon. And at last, we are going to have our professor, Dr. Drozdstoy Stoyanov, that is the part of the Department of Psychiatry and Medical Physiology of Medical University of Plovdiv. And he's also working in the Translational Neuroscience department. After that, we are going to have a panel discussion and questions and answers from all of you. So I hope that this 1 hour and 30 minutes are going to be enough to share all the knowledge that we know and everything that we also don't know. So hope that we can start now. Is Kamila here? Just to know that she is here. Lila, did you saw her that she is joining? Because I didn't, so.
Yes, she is here. I can hear.
Okay. So for Kamila, I wanted to say that she's an MD and she is a psychiatrist, as I said, and a staff in the psychiatry department of Indonesia in the General Hospital Surabaya. So we have some questions for you. Can you just share your video too in order to see you, or?
Yeah, I would like to start my video, but it said that the host can...
Okay, try again, because I am not allowing to others to share videos, but I can do it now, or maybe Lila can just approve it.
Yeah, still I cannot start my video because the host has stopped it.
So maybe this is from the general settings that we made in order not all of you to share some videos inappropriate. So you can start if you want, you can present yourself, even though I said some words about you.
Okay. Thank you very much.
You're welcome.
This video can be started. Okay, I am a psychiatrist from Surabaya, Indonesia.
Yes, continue.
Yes.
And we will wait if the video is going to be approved.
Yes.
Don't worry, just continue, not to lose time.
Okay, and this is the World Mental Health Day. Today we celebrate. So that we talk about stress today.
Yes. I don't know why you can't, because ask to start video, I will start. Okay. Yeah, I just click. Let me see if now it's going to work, because Sara already, I saw that she already shared her screen and video. Yeah, she's there. Okay, so we can see you. Yes.
Yes,
we can see you. Okay, hi.
We can see you.
Yeah. So you can continue.
Okay. Okay, thank you. I am a psychiatrist from Surabaya. Thank you for the invitation of this event. Happy to know all of you.
We are also happy to. So if you want, we can start with some of the questions that we already have for you.
Okay.
So first to start, because it's a World Awareness Day about the mental health issues. Can you tell us more about that, how we manage stress and maybe what is stress from your psychiatric point of view?
Yeah, about stress. Stress is something that that we experience, while a reality that we need daily is not is not like that we hope. And everybody has a lot of methods to manage stress.
So how then we manage that stress that we have from your point of view? How we can manage? Maybe we have some problem with Kamila with the internet. Now she's frozen. I don't know also if you can hear something or no. Is Kamila here? She can hear us, or I think that there is a problem.
Maybe we can fix the problem with Kamila. So I think we should move to Sara.
Yes, no problem.
And then we will change.
Yes. Okay, so Sara, I saw that you are here. Till we are waiting for Kamila, we can continue with you. So can you tell us something about you more than the things that I read? Yes?
Okay, hello all. So let me start at first introducing myself. I'm Sara Makka, I'm UGA Lebanon, and I'm a neuropsychologist and an intern clinical psychologist. I'm basically very fond of research, and I do find myself in research. And I'm very glad that we are gathering here today in order to be discussing mental health, especially that it is the Mental Health International Day. So we woke up today finding many posts advocating and speaking about the mental health issues that we are facing. And I'm so glad that we are finally organizing scientific events with professionals all around the world and making it open for the public who also experience their own personal mental health issues and do not find accurate guidance, especially inside all what we have on social media and life skills training and all what might be giving us false alarms and false information. So yes, if do you want me to carry on the questions that were for my fellow
yeah, I can ask you the question in your field, because we already made some choices of the questions that we are going to ask. Okay. So for you, we start with something that is neuroscience. So what is basically neuroscience for the dummies, as we say, okay?
Yeah. So every time we want to simplify any terminology or any new definition, we go on saying what is this definition for the dummies. Of course, no one is intended to be a dummy, but we're just meaning how to simplify it. So neuroscience is the science that is studying and investigating all of the biological factors which go behind our emotions, cognition, brain, anatomy, and everything. This means that neuroscience is the study of the brain and the nervous system, or the nervous system in general, on a molecular level, and what kind of behavior does it produce. What are the components which contribute to formulating behavior and cognition? It covers also sometimes genetics and epigenetics. And we have several branches of neuroscience. We have neuropsychology, we have neuroimaging, we have cognitive neuroscience, we have cognitive neuropsychology. So it is an interdisciplinary, very recent science.
Okay, and how has neuroscience changed in our understanding of mental health?
Okay, so in neuroscience became more availed or prevalent during the 1980s. By this time, psychologists and neurologists were growing interest in how to have more of an individualized approach in psychology. As we all might know that we have many personal differences between each person and another, and those personal differences create a great margin of difference when it comes to assessment, diagnosis, the appropriate treatment plan. So in 1980s, neuroscience started evolving as finding more specific biological markers, which give us more hints on behavior. So we were now giving more of a chemical meaning for behavior and cognition. By this time, neuroimaging techniques have developed much and we have started having functional MRIs, and we started having PET scans, and we're looking at the brain in a different way. So we started actually seeing anxiety on MRIs, and we started actually seeing depression on MRIs, and we started also seeing all the different neurochemical particles which contribute to mood, memory, and all of the executive functions the brain has: visual spatial awareness, cognition, social learning, social communication, and all. So since this point, or since this very turning twist point for the history of psychology, we started adding more of a chemical sense and developing our way in diagnosis more. And we started understanding more of the biological factors contributing to diseases. This means that we started speaking about genetics and the ability to have a hereditary psychotic disease. After that, our assessment scales and diagnostic measures, which have been distributed in the DSM, developed much to be way more specific. And we have started to finally see the effect of medication as traced on MRIs.
Yeah, that is going to be the next question, basically. What is the greatest improvement that neuroscience has provided for the psychological therapy in that way?
It initially provided much, let's say, the greatest progress that neuroscience has had on psychology and psychotherapy was initially on the level of diagnosis and not exactly psychotherapy. So it was on the level of diagnosis and understanding what is going on. But recently, we started speaking about something called rehabilitative or rehabilitation neuroscience. And this has given us insights more and more on how to link what we have explained much with chemistry and what we have started to and what
Somebody
we have
speaking. No worry, continue.
Okay, that we have started to be able to explain what we are exactly monitoring on brain imaging techniques and trying to keep track of what do they mean in the terms of therapy. So neurodevelopmental disorders, autism spectrum disorders, and several other like psycholinguistic also disorders have started to have and to gain new techniques. And in this phase, artificial intelligence interfered, and we started having more machines which assess and train individuals, especially with traumatic brain injuries, on computerized platforms, directly linking their cognitive skills and the training. It has contributed also to help us understand each person on a specific level. So initially, it was on the level of diagnosis, and then it got developed much to a level to start helping us understand more on the level of rehabilitation. So recently, we never had like computerized training, computerized psychotherapy, but now we do, thanks to neuroscience.
Yes, thanks to neuroscience. And then we go to the further things like personalized medicine, or to have an approach that is only for the individual. So then it will be like the second question that we will have is that recently the individualist approach in medicine had been in a great attention. And how can psychiatry be like that? Like to have really personalized approach to each person.
Yeah. So medicine in general, the more personalized it gets, the more successful it becomes. So of course, we are all like dealing with a mammalian sample, and we might have the same biological mechanisms acting behind what we see is symptomatologically. Yet, when it comes to mental health, we need personalized mental health even more. And this is because we have a high relativity when it comes to the way each person and another visualizes his own struggles and what has actually occurred. And when it comes to mental health, the slightest difference that you might have in your own story that you are telling for your psychotherapist makes a huge difference in the way you're going to absorb therapy and what your personality or how we visualize and perceive your personality as psychologists. So the slightest details have and carry effect on behavior, cognition, memory, consciousness, and consciousness. Since we have this great amount of variables acting underneath each psychological phenomena, we have a higher urgency to have personalized psychological medicine or psychiatry. Yet, it is very hard to achieve this because even until now, we do not have the exact neuroimaging techniques that like specifically and rapidly show us, for example, the concentration of neurotransmitters in a certain way, in a certain lobe. So we are able to achieve this in labs, but we don't ever go into a psychologist clinic or psychiatrist clinic and you sit under whatever machine, and the machine does not directly like measure how much neurotransmitters or how many neurotransmitters you have right now. Of course, the more we are able to translate neuroimaging into and incorporate it into clinical practice, the higher personalized psychiatry we'd have. But also on the level of psychology, we already have ongoing development for psychotherapy for it to become more personalized. Psychotherapy cannot be not personalized.
Yeah, but what about for example, the genetic background of one person in order how the person will answer for this approach? What do you think about it? Is it developing nowadays, or how is it happening now in your countries, for example?
So this approach is very, very important, and it actually became more, let's say, it was highlighted more in scientific research after experimental and animal psychology evolved. And this is because we started finding, and when the Genome Project,
the big one.
Yes. So after it was finally open to public and finalized, mainly finalized. So the Genome Project helped us track many genes which are associated with anxiety disorders and schizophrenia specifically. By this time, public started becoming aware that they started remembering and finding correlations that when their parents or their grandparents had schizophrenia, their sons, for example, carried anxiety and started experiencing those symptoms. And they started realizing that it's going more and more within families. And even though this is on a public level, but on the scientific level, all the scientists already knew. So now on the level of personalized medicine, now we know that yes, we are able to transfer and transmit the genes of psychological disease. But what we're now highlighting is how to manage your lifestyle way better in order to avoid, because you see, not everyone who has a psychological disease has the genetics for a psychological disease, and not all of those who have the genetics for a psychological disease are actually experiencing a problem with their mental health. So it's a 50-50% situation. The more you have higher lifestyle management and coping strategies, and this means not actually indulging in a very active or manic lifestyle, including alcohol, vandalizing on drugs, vandalizing on cannabis, and those which we have induced or chemically induced psychosis. So the more
Yes.
we protect ourselves and moderate, the better we have, or the less prone we are for psychological disease. We are not able also until now to get each person into the clinic and like conduct a karyotype or a DNA testing for him. It's a
Yeah.
very expensive process. And even if we did, it's not going to tell us more. We already know what's going on within his family. So this is a minor component when it comes to actually facing a mental health issue. It is important for research, because once we are able to find a way to revert epigenetically what's going on, we might be
Yes.
able to control the gene.
Yeah.
But this is when it comes to medication, and that's 50% of the process. The other 50% depends on lifestyle management and psychotherapy.
Yes. Okay. And is it true, for example, that suicide and depression had become a leading cause of death, and why you think is like that?
Yes, so CDC like yearly and annually highlights us with the correct statistics for the leading causes of death. Yes, we do have some fallibilities for those statistics, which are prone and present in each and every statistical mapping and statistical study. That is like the sample size being representative or not representative. If everyone is participating in this, if all countries are correct reporting, if each Ministry of Health is actually also contributing from each country with the correct numbers. So this might be a bit fallible. Yet, we do know that the cardiovascular diseases had been the leading causes of death throughout all of the times, and they are still. But we look at also the numbers below the leading causes of death. So, okay, the cardiovascular diseases are the leading causes of death. In the past, we used to have smoking, and with the evolution of the industrial revolution, we started seeing after like around 4 to 5 years that cancer is the second leading cause of death. So we also care about the numbers that are below the leading cause of death. With time, we have started to see that depression is the seventh leading cause of death, and it's still rising. Until one of the years, the number of, I think in 2017, I'm not sure, in 2017, it was on level 3. And this is a very high leading cause of death. So it's actually because we already have the genetics, and we're multiplying, so the possibility of transferring those genetics is higher. On a second level, depression itself is becoming more and more spread, and also because clinical depression in its most horrible status might lead to suicide. So what's actually meant by that depression here as a leading cause of death is actually the suicide.
Okay, so really, I thought that depression now it's on 6th place. I didn't know that depression is on 7th. I think that I read it recently, but I'm not sure. Maybe I didn't read from CDC. So it was very interesting to understand now.
My info might not be updated as well. We also have the respiratory diseases rising up this year due to coronavirus.
Yeah,
so I'm not really sure as well. Yes, it is growing. So we do care about the level, like where is depression, but we also care about how much it's rising, and it's still rising. So that's what's alerting.
Yeah. And then the final question for this talk with you. When we always discuss the psychological diseases, we rarely really discuss the potentials, the psychological potentials. What are those gifts that someone may have?
So this is a very interesting
potentials. Yeah.
Yes. So this is a very interesting question, because when we discuss psychology, we always discuss maladaptive psychology, or the vicious part of psychology, or how sick we are and what are we facing. But rarely do we actually discuss about the positive psychology, or what traits does a person have that can be considered as a benefit. So maybe it's because when we think about psychology, we think about resolving medicine. So if resolving diseases. If a medicine is not going to highlight, for example, the positive issues that a person might have, or like what type of or what blood type might help him survive more, or whatever. So those are rarely highlighted. Yet it might be a very good chance for us to start seeing things differently. So, first of all, if a person, the higher the person has on the level of adaptive skill, and the higher he understands and the better he understands adaptation, the more we expect him to have a sane and a stable life, or a life that has a higher mental health capacity. This means that the more resilience he has, the higher understanding of life expectations, because having low or having very high expectations or very low expectations out of your life and out of the logistics of personalized life, it actually leads to the clash, which leads eventually to depression because of the disappointment. So the exact expectations that we have to grow out of life, being very dynamic, having resilience, having the self-talk that does not end up being a chattering mind or obsessive talk. So those are gifts a person might have. Those are what makes a person wise. So having a supportive community that you can discuss with and speak about whatever you have in mind with them, having a loved one, having a spouse whom you really care about, those are gifts which help you have a better life. Having high IQ as well, even though it might have its own let's say down points, like having higher risks of being obsessive, or let's say being extra creative, or being easily triggered into anger. Yet having high IQ eventually, if accompanied with correct and achievable psychological traits, leads you to have a better control of your life. We do have many psychological gifts, like traits which turn out to be gifts, even the genetic factors. So that if you do not have the genetic factors for diseases, this is a gift. And if you have protective genetic factors against psychological diseases, like genetics which can contribute to the myelin on your nervous system, genetics which contribute to the concentration of GABA and prototypes of GABA, and all of the neuroscience or neurotransmitters behind regulating your mood, this is a gift. Going to the gym, having a healthy lifestyle is also a gift. So some of the gifts are achievable, and some of the gifts we are born with them. Yet the stuff we can achieve contribute better to our mental health.
Yeah. So very important, the adaptation mechanism that you just explained and everything. So really it is very important for those coping strategies and how those potentials can grow in time. And just another question that I want to ask from my point of view, do you think that really the IQ is a type of protective potential?
You know how there's this always we always see the films of like Frida Kahlo or Salvador Dali or Leonardo da Vinci. They were people with really high IQ, but they were psychotic. So
that's why I'm asking.
Yes, so it's actually like a sword of two sides. So the higher the IQ, so let us bust that's electricity in Lebanon. C'est bien, yani.
Okay.
So let's bust the myth out of this. Excuse me, I'm fixing the light.
Yeah, no worries.
So we think that the higher IQ there is, the more genius the person is, the more susceptible he is for psychological disease. This is partly true because the area which activates your creativity is able to also contribute to the area which activates your schizophrenia in case you had it as a hereditary genetic factor. Yet, this is not the case all in all, because those people who have genius tendencies often face disappointments when it comes to socializing with others. And this disappointment happens because they do not find their mental mate or their mental pal whom they can always discuss the same issues which they face, because they function on a different level, they function on a higher level. And having always being disappointed and not achieving this kind of emotional bonding eventually contributes to depression and contributes to mental health issues. Yet, if this person who has a high IQ is able to understand, like on his wisdom level, to be more forgiving and to be more thankful and to be more gracious and to focus on his, let's say, positive traits, he will be able to find his salvation in some way that is going to make his life actually better. So it depends on what you focus on, because you see, the art of adapting is also IQ. Some people have high academic IQ and lack social IQ. Some people have very high social IQ and lack interpersonal IQ. The more awareness you have about your situation and where you stand in this universal map, the better understanding you will have of yourself and how you're going to deal with others, and hence the less disappointments.
Okay, so it was very interesting to learn about it, because I always thought about, okay, but what if you have a high IQ, but what about your mental health? So those things, maybe we can't separate them really. It was very nice listening to you while you are speaking. It looks like really you love your job.
Yes, I just want to highlight one last thing, is that the discussion of whether IQ is unique or it's branched, if you have multiple types of IQ or if you have a unique IQ, is still ongoing. Yet you might find people who have really high IQ at some areas and lack it on another level. And this is why when you start socializing with people from other majors, you'll start finding that they have common personality traits. So the people of medicine have common personality traits, people of psychology have common personality traits, and you will find that many psychologists do face mental health issues more than others. And this is because of the level of awareness they have. But the level of awareness they have of what's going on is partial and it needs to be upgraded. So what I want to say is that things are very, very relative. It depends on what is motivating your IQ and what is actually happening. And in case you really had the basic life components of mental health, then you're not likely to fall in, you're not susceptible for psychological disease unless you are creating the cycle in your mind. So unless you are thinking in a disabled way or in an unfunctional way.
Okay, perfect. We have so many questions for you. They are waiting in the list. I have received so many. So later we are going to speak about those things more. And thank you very much again. And now I will see if Kamila can speak. Kamila, can you hear us? And you can speak? Try now.
I just want to understand something. Do you want me to answer the questions on WhatsApp or where exactly?
Later, I think that in 5:25 Tehran time, we will have the panel discussion with questions and answers. So then you can answer those questions. Isn't it? Yeah, like that. It's the best. Okay. Thank you. Kamila, can you hear us? Can you start speaking? But you unmute. Yes, unmute your phone. Yeah. Your microphone. Now it's okay? Yes. So there is some problem with the connection, as I can see, so we can be faster because also Professor Stoyanov is waiting for us to continue and we are short on time, as I can see. So yeah, we started to speak about the stress. You explained what is stress, but can you tell us how we manage stress?
Yes, there's no definition of stress that everyone agrees on. What is stressful for one person may be pleasurable or have little effect on others. We all react to stress differently. And then how we manage stress. First, we have to know the source of our stress. Then, what is the source of our stress? Is it come from ourselves, or is it come from the situation we meet daily, or what? After we know the source of our stress, then we have to accept the stress, and then talk to someone. Always help if we have stress.
Yeah, but what you think that how you can increase those contacts, and how, especially with these things that you are going to search for help, you can probably somehow increase these mental health awareness issues?
To increase the mental health awareness issues, we can talk to everyone we know. Then we can open up about our experience. We have to always educate ourselves about stress, about mental illness.
Okay, and can you tell us then those signs of mental health issues? What are the signs?
A lot of signs about mental health issues. In my experience, many people have signs. I'm sorry.
What can they have? So how you will understand if somebody is really having mental health issue problems, or a person is stressed? What you do as psychiatrist?
Many people have sleep issues. Issues. Then somatic complaints.
Okay. What else they can have?
A lot of people have headache, then stomach ache.
Yeah, those somatic complaints that you already said. But yes, are there really some known cures for mental health problems? How you will treat one person that has those issues?
Usually we evaluate their life, the source of stress from their life, then the daily the habit of themselves, the occupation, what are their feelings and thinkings.
Yeah, and do you use some questionnaires to measure these problems? Some perceived stress scale questionnaires, or some other different types of questionnaires that you use in your field?
If it is a disorder or illness, the gold standard always clinical.
Okay, it's always clinical in your country. Yeah. Okay. And can you tell us, can we connect science really and the diagnostic methods that we use for treatment of mental health issues?
Yes, of course. For the treatment, we use the science about neurotransmitters, and a lot of problem that connect to the science and symptom. Any individual experience.
Yeah, and what do you think? Can one magnetic resonance, the functional one, be used as a diagnostic method?
Functional.
Yeah.
Yes.
Yes.
It is not gold standard for diagnostic.
Yeah.
Usually we use that for research to deepen and more understand about how the brain works, how the neuroscience, how the connection of the neuroscience and the symptoms of a patient in a functional level. But in my country, it is very I don't know if any hospital or maybe facility has the functional MRI here.
Okay, yeah. So you are not using it a lot?
No.
No. Okay. Okay.
It's not a gold standard for diagnostic.
Okay, Kamila. Okay, thank you very much. So I think that we just cleared those 7 questions that we had for you. Thank you very much again. And later we are going to have the panel discussion, because now we have to continue. As I can see our professor, Dr. Stoyanov, that he is waiting for us. And we are very happy that he can join today, because he had a lot of meetings, but he was willing to participate. And I'm very grateful that he is now here with us. So Professor Stoyanov, I already said, who are you? What are you working with? So can you please present yourself to the public here virtually?
Yes, thank you for your invitation. I'm teaching psychiatry in the Medical University at Plovdiv, doing research in the field of burnout, neuroimaging, and molecular neurobiology, and seeing patients, of course, every week, twice a week, in an outpatient office. And I'm just out of the National Council for Mental Health, as the country is about to initiate reform to optimize or to enhance the effectiveness of the mental health care system in this country. Well, basically, that means that I try to combine some teaching, academic research, and clinical commitments with administrative or political activities. This is as far as I can tell about myself. The remaining can be told by ResearchGate, I guess.
Yes, of course, or Google Scholar. Or maybe the web page of our university, as I share with the others, in order to know. So in order not to waste our time, because I can see so many questions from people that are here for the questions and answer panel that we will have. So I will start with you, Professor Stoyanov, with the first question about what are the red flags for mental health issues from your point of view?
Well, as I told you, these are systemic problems. I actually made a hint towards that statement. In many countries, there is heavy inequality or inequity in healthcare delivery. And this has nothing to do with gender, race. It has to do with economic disbalance and with huge diversity of the economic models and the models for funding and integration of mental health care delivery. This, of course, has many things to do as well with the robustness or the strength of evidence when selecting a diagnosis or producing a treatment plan. These are two main, as Mariya put it, red flags. One is about the system. The organization of the system and its functioning, which is dependent, of course, on money and the adequate allocation of resources. But the other is about the research gaps we have. And these gaps are in between the psychiatric or mental health disciplines like psychology, clinical psychology, and psychopathology, and the remaining areas of medicine, which traditionally for the last 40 or 50 years, they operate with the so-called nomothetic networks. Mm-hmm. Well, this is an expression which is more or less unfamiliar in the field of mental health, but it is about very fundamental, very by default knowledge in medicine, that clinical observations have to be supported in diagnostic terms with various biomarkers of disease, molecular or imaging or electrophysiological markers. And this is operational. It's very standard in the other specialties. It's not the case, however, in psychiatry and also in clinical psychology. So the other challenge or the red flag is how to achieve strong enough evidence in diagnostics and drug choice and monitoring of the efficacy of therapy.
Yeah. And then we continue to speak about the new field that emerged, and we work together in that field with you, and I'm very happy about it, is the psychoneuroendocrine immunology. So can you tell us more about it?
Well, this is a field which is new in terms of the methods and in terms of the targets we can explore using various techniques and various methods which range from neurobiological to imaging and physiological methods. But as a conceptual rationale or roots of the conceptual rationale, it's relatively old. It's about 80 years old.
Yeah.
And has many things to do with geriatrics and gerontology. And it is about the integration of the knowledge about different mechanisms of homeostatic control over the steady state of the organism and the mental system, which are integrating immunological and endocrine pathways into the central nervous system regulation of those pathways. And they're bidirectional. For example, you know, the brain can control many processes in the periphery, but also periphery can control brain or impact the brain functions. For example, like the so-called leaky gut mechanism, when the translocation of bacteria from the gastrointestinal system into the circulation can cause autoimmune response, and the autoimmune response in the end of the day can affect neurotoxically the central nervous system. So it's bidirectional. It's an impact of the brain functions over peripheral regulation and of the peripheral homeostasis on the brain functions.
Yes. And when you continue speaking about psychoneuroendocrine immunology, it was very interesting for me to learn about it, that firstly, it was used the term immunopsychiatry, referred to psychoneuroendocrine immunology, and then they changed it and they upgrade it with the endocrine and immunological things in it. Yeah. And to continue with that, just to ask, because we couldn't describe those things in the very beginning, can you give explanation about what is the good stress and what is the bad stress?
Well, there are different methods or different evaluation techniques to assess the eustress and the distress. And of course, it depends on the variability of many, many different markers, including immune homeostasis, including cardiovascular functions, and also the central nervous system activity. And certainly the criteria for distress is harmful dysfunction. Whenever the everyday stress or the critical stress or the traumatic stress exceeds to an extent when it can cause harm to yourself or to the others. And also it causes dysfunction in terms of the evolutionary designation of the organic or mental function.
Yes. And then we go to the PTSD and depression. As those stress-related type of disorders. Can you tell us more about it and how you diagnose them?
Well, these are very different categories. Depression on one hand can be endogenous whenever it is caused by dysregulation of certain intrinsic mechanisms, biological mechanisms, but it can also be psychotraumatic. It can be caused by psychological trauma. And in that sense, it overlaps with PTSD, which is in all cases a result of psychological trauma or critical experience or catastrophic experience like earthquake or military conflict or a car crash. And certainly most of mental disorders, they have comorbidities and overlaps, and it is very difficult to define them as discrete entities. So we prefer to define them in terms of spectra. Well, the spectrum of PTSD and depression, what they share about are various mechanisms of disease, which also include immune homeostasis.
Yes. And what do you think that are the best way to cope with stress? We already discussed coping, but what do you think is going to be the best to cope with stress?
Certainly, we can always approach psychological counseling in that terms. But in everyday life, if we do not have the necessary resources to approach a psychological expert counseling or coaching, I believe that there are various ways, like, yoga therapy or meditation or music therapy or art therapy, any kind of sport and creative activity.
Yeah, everything that is going to be like a hobby to you, just to keep your mind
as an alternative to whatever is stressful.
Yes. Okay. And what is better, like we have a question here, what is better, drugs or therapy for mental health issues?
Well, the answer is both. Well, it is not possible, for example, to address depression or a panic disorder without combining pharmacological therapy with psychological therapy.
Yeah, so you go always together, okay? And is it true that suicide and depression had become a leading cause of death, and why?
Well, this is one of the main causes for death on global scale. There are many hypotheses. The leading hypotheses in the last decade are concerned with the change of lifestyle and transition in values from more or less traditional and conventional values to diversity of values, also the migration, also military, local and regional military conflicts which force people into emigration, and also a collision of cultural values and their on a global scale. Eventually, suicide becomes an exit whenever there is a collapse or a vacuum of values in certain civilizational context.
On which level is Bulgaria with the cases of suicide?
Well, it is alarming, and various projects which are led by the National Center for Public Health and Analysis and funded by the European Economic Area grants in the last 5 or 6 years are addressing that issue.
Yeah. Okay. So now I think that we can stop here and give the microphone to Laila in order to play the video. And after that, we are going to discuss only the questions that are in the panel questions and answers from our guests here. So we will have enough time, I think. Isn't it, Laila? Yeah, it is. Thank you, Professor Stoyanov, and we will continue just in a while. We are waiting for you, Laila. Ella, I think there is a problem. Yeah. So thank you very much, Lila. And now I can see Sara, she's back here. We will start with her because we have some questions first for her. Then we are going to continue with Professor Stoyanov. And after that with Kamila with some, we have 3 or 4 for each of you. And we will finish for today's talk.
Okay.
Let me see now the questions. So, Sara,
Mariya, can I ask you to go
yes.
first? Because I have to pick my kids from the kindergarten. I'm so sorry. I'm so sorry indeed.
Okay, no problem, Sara. We'll wait. So, for Professor Stoyanov, how to become a successful neuroscientist?
Well, you need persistence. I'm sorry about the video. I'm trying to launch it, but apparently the connection is slightly poor. I need to change this computer. Well, the good scientific effort is very much about persistence. You need to be persistent, and you need to have a cause and to be a good believer.
Of course, yeah. Without work, you can't achieve anything. Yeah. So the second question that we have for you is, could you please talk briefly about the power of the brain and its evolution through human history? This is very interesting.
Yes. Well, evolutionary brain functions are exposed in a large scale of studies which practically span the entire theoretical framework from the area of evolutionary neuroscience to the area of social neuroscience. And certainly what is critical about its understanding, perhaps, it is prefrontal cortex function, and especially the ventromedial prefrontal cortex function, and also its relationship with the parietal and supramarginal areas. These are the most recent evolutionary brain regions which actually dominate and which actually control our mature behavior, what transforms us from animals to humans. And we should understand better the neurochemistry of those areas and their interrelationships with the endocrine and immune control of the organism.
Let's see, there is another question. I have read few papers about, however, okay, does this mean a mental illness or what? So is a reincarnation type of schizophrenia?
Not at all. It's a cultural phenomenon. But most of psychiatric or psychopathological phenomena are culturally dependent. I can strongly advise everyone, can send you a link in the chat to read more about the interference of mental health values and cultures in psychopathological assessment. I will send you shortly a link on the...
Yes. Thank you very much. So do we have some other questions? No, those are the questions that we should answer. So thank you very much, Professor Stoyanov. You can leave now the meeting, and I'm very happy that you managed somehow to be and take part of our today's talk. And I hope that next time we are going to be more people and we are going to be more successful in what we are doing. So thank you once again.
Thank you very much. You will receive in a moment
thank you.
The link if this is just a direct message, I will ask Mariya to also share it with you.
I will share it. Yeah, it's direct message. So we continue with Sara. Bye-bye, Professor Stoyanov, and see you. And Sara, let's continue with you just to open the questions. Yep. Lila from here. Okay. What is your idea about the excessive use of internet in the digital world? Does it have any neuropsychological effects?
Okay, so we don't have any named disease for this. If we use the DSM, which is our major, or let's say the ICD-10, which is our major way to, or the most standardized way to classify psychological diseases and mental health obstacles, we don't have any classified disease that is directly relevant to the usage of internet and social media as well as mobile devices. Yet we have many spoken of and renowned articles published with very renowned publishers discussing the effect of the rays which are emitted from the mobile phones, their effect on our cognitive health, their effect on our sleep cycles. We also have many articles discussing how this affects our social behavior, the effects of many recent topics like social media on our social cohesion. So we don't have any classified disease, yet we do know that one of the most important effects that we are right now living and witnessing is the silent envy that we have due to social media posts, what we daily scroll and check.
Recording in progress.
Okay, so what we directly check and keep an eye on daily basis from our Instagram profiles, Facebook profiles, Snapchat profiles, whatever the social media platform is creating some sort of a silent envy, is creating some sort of a high expectation level of life, which we already discussed its effect on our disappointment and hence leading to depression. The other major effects that it has is the fact that when we keep on scrolling between videos which are very short and are majorly like a minute length, we are creating a status for our mind that decides that the attention span is just as short as this video. So when you get used to having only an attention span only relevant to the videos or to the information that is being given through this video for only a whole minute or a minute and a half or even less, then we are and then you're receiving a new info and then a new info and then a new info on the same basis. We are creating a shorter attention span for our executive functions. So I can go on the list endlessly, and we can speak also about the positive issues, but I will be only discussing those two.
Yeah. Let's see the second question for you. Could you tell us about pregnancy psychosis and its effects on the fetus?
Okay. Okay, so over here we have to discuss two types of psychosis relevant to pregnancy. We have the prepartum, the postpartum. So the psychosis which occurs during pregnancy and the psychosis which occurs after pregnancy. And let us just like defragment and make ourselves more familiar with the term of psychosis. So psychosis is actually the psychological illness which alters the brain chemistry in such a way that we are not able to tell basic functions like exactly like time, introducing yourself in the correct way, understanding exactly your location, or having correct judgment on issues. So psychosis includes diseases like bipolar disorder in all of its subtypes,
Yes.
schizophrenia, clinical depression, psychotic clinical depression. And on the other hand, we have neurotic disorders, which keep your awareness and judgment intact, unlike what happens in psychosis. So let us rephrase the question in such a way that we answer on both levels. So whether the psychological disease is affecting the brain basic functions or not. So whether it's neurotic or psychotic, or whether it is a personality disorder.
Yes.
So pregnancy creates all of this range of hormones that we all know about. Yet some people are more susceptible due to genetic predisposition as well as lifestyle to having underlying conditions which pregnancy let's say explodes or brings up to the surface. So on this phase, you might become more depressed, more anxious, insomnia. You might be experiencing insomnia, and you might start having delusions. So
even delusions, I didn't know about it.
Yes, there are some delusions, and even you can become hysterical during pregnancy. But this is very relevant to each person and another. And we all know about the postpartum depression, like 2/3 of women have it after pregnancy, after giving birth. And this is normal due to the massive drop of female sexual hormones, estradiol, and the progesterone. So this is very normal because we're having the hormones which are bringing up our mood up, just going down. We need time to cope. In case the person have had previous tendencies to be depressed, it is going to be hard to leave the status. However, mental health issues and encounters are not contagious. So you're not going to give it to your fetus. So you're not going to transfer it to your fetus.
Yeah, that is very important to know.
Yes, yet atypical drugs related to the SSRIs and having depression while you're pregnant, not after pregnancy, during pregnancy, has a higher risk, has like a 10 to 15% higher risk to having for contributing to the fact that you might have a child or a newborn that is less in weight. And in case you are taking atypical drugs during the first 3 months, the first trimester, which is very essential for the development of vital organs for the fetus, you might be experiencing, your child might be experiencing low weight and lower immunity. And those are the most recorded ones. Yani those are the ones which are higher in statistics and prevalence. The rest are very specific to each person and another. And I want to say something, that in case the depression persists and let's say you're passing through this very rough time where you're having delusions, you won't be able to take care of the baby in the most nutritive manner. So this is also going to affect your communication with the baby as a newborn, which is very essential for the baby's mental health stability.
Yeah. So we have lots of questions coming for you in the chat, but I can choose some of them because we will need time, of course, Kamila also to answer some of them, and then we are going to take all of us. We can turn on the videos and we are going to make one photo to just remember this event as something that was for first.
Yes.
Yeah. And the third question that is for you, as it is has been proven that the homosexuality isn't a genetic disease, as there are a lot of studies regarding this issue. I would like to know if homosexuality and gender dysphoria are a mental health issue, and how psychology or psychiatry explain this phenomena.
Okay. So, okay, this is a very interesting and a very sensitive question.
Yeah.
First of all, until now, we do not have a very candid or a fixed judgment on the issue regarding the gay gene. So we still have conflicting studies, studies which say that, yes, we do have a gay gene, and studies which say we do have a gene for sexuality and homosexuality. Yet in 1993, the gay gene topic was brought up to the surface. Genetic biomarker was discovered. It was I think it was XQ28 or XN28. So by that time, we started having this discussion. But until now, and until now, we are discussing whether the X chromosome being fragile or non-fragile might have a contribution to the person's sexuality. Yet, what I want to say is that we do understand the importance of genes in prototypes, protein expression, our brain, and what goes on. Yet, we do also know that this is not the only contributive factor to it. So I think that we are having a cognitive fallibility when we think that in case you have the genetics for being a homosexual or a heterosexual, then you're gonna 100% become a homosexual or not. Because similar to mental health genetics, in case you have the mental health, or let's say in case you have the psychological disease gene, this doesn't mean that you're gonna have it 100%. So genetic and heredity is a very essential predisposition, but it's not the only precursor of behavior. As for gender dysphoria and homosexuality being classified as gender diseases, as psychological diseases, so let's agree that during the final review of the DSM-4, homosexuality was removed from psychiatric definition as a disease. Gender dysphoria is also under this. Now we have the DSM-5, DSM-6 is under review. This is gonna be always developmental. Many factors are going to contribute to how we visualize cultural phenomena as a disease or not, similar to the reincarnation question. Whenever the sample size is greater and whenever the person is more adaptive with himself and the society, with his phenomena or whatever he's living, the less we are to call it a psychological disease.
Yeah.
And I want to tell you that the idea of being heterosexual or homosexual or gender dysphoric is kind of minor right now. The major progress in defining your gender identity, or where we have gotten to be, is now the discussion on your preference or being binary or non-binary. And those issues have exceeded the level of psychology and the circle where psychology can intervene. This has become partly political, partly democratic, partly regarding international law. So what I mean to say is that genetics and psychology are not the only ones who are going to give their opinion on this issue.
Yeah. So I think that there is one more question that I saw for you. I will just try to find it. I'm sure that it was for you because yeah. How deal with a partner dealing with depression? And are depressed people who are on medication are ready for any kind of relation? How to deal with them?
Okay, this is a very challenging situation. So in this case, there is a risk for the mental health issue to become contagious, because the person might not be able to contribute to your wellness. So if you're living with a partner who is depressed or facing any other type of psychological disease, it's going to be challenging. because what you really need out of this relationship, you're not really receiving it. So practically you are with a dysfunctional partner who is inversely creating the same status for yourself. Yet not all people who are facing depression are on the same level of functioning. And not all people who have depression, their partners are needy, or people have different way in dealing with things. So it depends on what you really want. And right now I'm going to answer from a consultative point of view. So in this case, let's go on being very honest with our partners, yet respecting the boundaries of the depression. So you have to be very candid with what you want. You have to know what is really your need that cannot be delayed, and prioritize it, and discuss it with your partner on how it shall be achieved inside the depression. In the depression, or when you're dealing with a depressive partner, you do not have to forget yourself, because if you're going to support your partner in such a rough time, you must have at least the basic potentials in order to survive. You should not cut yourself off life or become too supportive to the extent that you burn yourself out. This should be a byproduct relationship. This should be a conversational relationship. So you have to understand the needs of your partner. You have to understand the level of depression. You have to know what is exactly initiating the depressive episodes. Is it stable? Does it change? Does it get harder? What type of medication is he having? Because also many many depressive drugs also have their effects on concentration levels, memory, sexual function, and all. So they must be having this conversation on the challenges that they are going to go through. And the person must prioritize what he needs and discuss how to achieve them, so that you don't get to a level where you burn out. And this is not an easy job. So you have to be aware of what you're doing, and you really have to want it in order to be able to proceed.
Yes. Okay, thank you, Sara. Now we continue with Kamila. Let's see if we are going to have more questions. I think that we have also later. Okay, so Kamila, I can see that you can hear us. And for you, we have some questions. What are some of the most efficient therapy techniques for mental health issues? Therapy techniques.
Yeah, most efficient therapy techniques usually including healthy eating and diet. Then physically active, you can do sport that you like. You have to connect with other people, and it is important to learning new skill, and it is important to always giving others and be happy from giving. And usually the most efficient is mindfulness. You have to pay attention to present moment, here and now. That's the most efficient.
And so how does really this self-therapy work?
Self-therapy work through practice and exercise. You have to learn self-therapy is about taking command to develop and implement the skills that is necessary to better anticipate your problems and manage your mental health challenges.
And do you know, for example, an easy way how some modification of the lifestyle can increase the IQ in children?
Scientifically, IQ cannot be increased. Increasing IQ maybe 5 or 10 points is not usually it's not meaningful.
Okay.
And it's also depend what etiology caused the low IQ. Usually the learning and study and therapy is depend on individually adapt because yeah, IQ can be increased.
Yeah. And another question for Sara, I can see here. Thank you, Kamila. And we are going to finish with Sara. Sara, are you here? Yes. So just to read. Now, this is the final question for you and also for all participants. How depression and chronic stress affect the brain physiologically, and really, can it affect the level of IQ and intelligence even? Because we started to speak about IQ and intelligence.
Yes.
Yeah.
So we do know that we have the fight and flight responses, which are the basic nervous responses we experience once we are exposed to stress. So when you have prolonged stress, you are activating your stress hormones, which are basically, you start with the adrenaline, which activates your immune system, which makes you more active. Yet when you enter the cortisol phase, which is the exhaustive phase of stress, you start releasing the cortisol, which activates insulin, which decreases your immunity, which makes you crave more caffeine, more carbohydrates, and the insulin will break down your sugar particles, and then you'll have lower sugar, you'll crave for more carbohydrates to raise the sugar, you'll have less physical activity, your sleep cycles won't be as deep as they were in the past. You're going to pass through this phase where, like all of the patients say this, they are there, but they are not really there. So they are like in the office, but they're not really conscious about being there. They're not that aware, or they have this cloud in their mind, like they're not able to have this silence where they can just focus on a single thing. This is one of the greatest complaints we hear when it comes to stress, and so all of mental health in general. In the case of this is stress, I mean in general. The case of depression, it's a bit more sinister. So in the case of depression, your cognitive skills in general, and especially your memory, are going blanked, because there is a chemical component contributing to the status, that is your serotonin. So your serotonin is either hyperactivated or low activated or hypoactivated. So in this case, the neurotransmitter which activates your brain functions is not stable. So you might be really off record. You might wake up one day feeling like your head is really heavy, and that you can at most do your like basic daily tasks or what you're supposed to do. You won't be able to go really intellectual. So it does not affect IQ on long term. It does not affect IQ on short term. So it's not like if you have depression, you're less intelligent. It's not like that. Yet, if you have depression for a long time and you're not using your brain wiring and you're not using your cognitive skills, those are going to go lazy here for sure. And this is a normal state. What you can do in this case is to instigate yourself, excite yourself to stay connected with learning, with reading, and with intellectual skills, which are able to keep your mind and brain activated, because learning itself is a protective factor against depression and Parkinson, as well as Alzheimer's. So the more you learn, the more you keep your brain active, the less likely you are to have lower brain frequency and lower brain electricity, if I want to say it in this way.
Yeah. So thank you. We have had like so many interesting questions. I think that we managed to answer those that are really into this field of the mental health issue problems. And I'm very happy that we had a successful dialogue with the three of you, Professor Stoyanov, you, Sara, and you, Kamila. And now I'm just willing if all the participants really can turn on their camera. In order, I think that Laila is going to make one photo in order to remember this event as the first organized event by people that are part of Universal Scientific Research Network. So I can't see Laila at the moment because I'm speaking without the microphone on, so sorry about that. So can you please turn on all of your cameras in order to have
Please
one?
turn on your
Yes.
camera, please.
Yeah, but
We're going to
there are so
screenshot.
many. Yeah, so we are only 7 people. Yeah, only that much? No, please.
Oh, please turn on your camera, please.
Yes, where are the people from Bulgaria, please, guys? You're in the.
Yeah, we have Indonesia here also.
Yeah, they are in the next room, but I can't see them. I have to go and knock on the door, and I can see from England, Lolita. Hi. Yeah.
Hello, Sahrul.
There are so many people that I know, but they are not joining with camera. Unfortunately, Professor Stoyanov, he left, but we know that he had work to finish. Guys, can you please? No, nobody is willing, so it doesn't matter.
Okay, that's better.
Yeah.
We're just like
Stoyanov, yeah, turn on the camera, please. We can see you. Yeah, okay. Okay.
I'm screenshotting right now.
Okay. We are done? Yeah.
I think we are done.
Yes. Okay. So guys, don't forget to please really to fill the form that we send in the chat in order to get your certificates. I hope that this was interesting for you. We didn't want it to be as a type of a webinar. We wanted to be a dialogue in order to have lots of questions. Unfortunately, we couldn't answer all of the questions, but we hope that maybe next year we are going to have maybe bigger event, Lila, so we can organize it with other participants that are part of USERN family. And I hope that these things that I received now on my phone, like I wanted to read it for you, that this is from the World Health Organization, that they are saying that depression and anxiety went up more than 25% in the first year of the pandemic alone. So you can imagine how much it is like increasement of those conditions. And if you think that you have depression, remember, don't be afraid to seek help. With the right support, you can get better. So really, it is like that. I hope that we somehow introduce to you the mental health issues, problems, and we can, every one of us, we can do some things in order to make better approaches to treatment and maybe the awareness of these problems. So thank you once again, until the next time. If Lila has something to share, to say, I'm happy to hear her.
Okay, thank you so much for everyone, for Sara, for Mariya, for Dr. Kamila, for Dr. Stoyanov, and all of the participants. We would like to say thank you so much for participating in this event, and we would like to invite you all in the end of this year. We will also have our third USERN UGA collaborative events. We will talk about the research ethic. We will talk about how to choose the best research methodology. So if you are into research, if you are into scientific approach, you can join our next event, our third UGA collaborative event in the end of the year. We will share to you the link. We will share to you the poster, maybe in your via your email. You can like join them, or maybe if you still want to be in the WhatsApp group, we will also share the information in the WhatsApp group. And don't forget to fill all your information in the WhatsApp group to claim and receive your certificate for this event. Thank you so much.
Thank you.
Thank you, and bye-bye.
Bye-bye. Thank you very much, everyone, for joining this event. Bye-bye.
Only we are saying bye-bye. Nobody's saying. Doesn't matter.
That's better.
Bye.
Bye.
See you.
See you.